Next, we're going to look at the PSP phosphor plates. These are one of the digital radiography units that are available out in practice. So you may have had these used on you before. The digital sensor here, the PSP plate, as compared to the Schick 33 sensor, you'll see in the video there's a cord attached to it. So these are a cordless version of a digital radiograph. So as compared to the conventional film, these are very similar in size and in the actual width of them. So it's very similar. You may not have noticed, even if you had them done on you, the difference between the conventional film and the PSP phosphor plate. So the difference with these, as you'll see, we've got size 2, 0, 1, and 4 here, and it comes in many different sizes for many different purposes. So one of the purposes, we may have a size 0 to be used for when you have a client or a younger child and their mouth is not fully developed. We'll have a size 2 for potentially adults for bite wings or periapicals of the posterior molars. We have a size 1 for maybe a mixed dentition when it's a child to youth who's kind of developing but not quite big enough mouth for a size 2. And our size 4 there for our occlusals. When we take an occlusal image, you can gather more information on one actual PSP plate. So when we're taking a look at these are the photostimulable phosphor storage plates, and they are widely used for an intraoral radiograph. And the image receptors allow the indirect digital imaging acquisition, and more specifically, it helps us capture a latent image. So you'll see here, just like the conventional film, on this side it says opposite side towards the tube head. So the blue side is what's going to face the radiation exposure on the client's cheek side. Okay, so that is going to be where our latent image is going to be captured. So we have to make sure that when we're putting it in the packet, so here is a barrier. So this helps with infection control because these are not a one-time use, these are reusable. So when you place it in, we want to make sure that the actual black side is facing out and that the blue side is facing towards the black cover here. And this allows the protection from light exposing this side while we're waiting. If you have it placed opposite, you're going to see the blue side is facing out. It is constantly being exposed to light, and that can damage the quality of your image. So that becomes a problem when you go to expose the client and when you're processing and trying to develop. So taking a look here at our actual phosphor plates, one thing that the clinician needs to do is make sure that the integrity of those phosphor plates is being maintained. So you can see here, if I shine the light a little bit, you can see the bend right here. So this means either the client has bitten down, the clinician has bent the very soft, malleable plate, and that can create a line or distortion within your film when you're exposing the client. So the integrity of your phosphor plates is so important to the quality of your image. As well, you may be able to see here, if I zoom in, is this little scratching at the edge. And you can see that the actual phosphor portion here is starting to lift up away from the plastic side. If I bring this one forward, you'll be able to see as well, it looks like there's some bite marks in it. And again, the phosphor is starting to peel back and becoming kind of tarnished in that way. So the issues with that is the diagnostic value to your image. So if you were to take an image, and I'll show you in a second an example, with one of these, you're going to have potentially an area on your film that is imposed by these scratches or these bends. And that can limit how much diagnostic value your image will have. So it is the clinician's responsibility to take these out of cycle once they become bent or damaged. The issue most of us may have as well is knowing when to replace them. So when you start to see that bending, when you start to see scratching, it is time to replace them. They also have a lifespan. the lifespan is approximately 50 times. So although they are reusable, every time you're processing them through, whether it's your ScanX machine or your PSP scanner, it is exposing this to a red light and it's erasing the image as it's processing and connecting and creating a digital image. So every time it's doing that, it's actually taking a little bit of wear and tear on your phosphor plate. So they do have a lifespan. So it is time to replace them after a certain period of time. The issue you'll start to see potentially is some darkening or lightening and just issues within the quality of your image. So here we have an example again of the quality assurance process. So a way to help with your mounting is always make sure that the A goes in to the packet. So you can see it says opposite side towards the tube head. And when you place this into the client's mouth, you want to make sure that the A is towards the floor. If you maintain the A towards the floor, you'll always be able to tell where that image came from. So if you're working on a full mouth series and you're taking multiple x-rays at one time, and then you process those images, you may get a little confused as to what one was from where. The best way to help you navigate is to utilize the little A. Again, when you expose, this side is going to be towards that tube head. So now we're going to take a quick peek at our scanner and some potential quality assurance issues that you may see. So I'm just going to take this here. Sorry for that. So in front of me here, I've got the ScanX machine. With the ScanX machine, you would set your phosphor plate right in the location. So if this was our size 2, it says 2 right on top. I would place that in, and then I would start on the computer and push it into place, and it would scan my image in and create it into a digital imaging system. As it comes through the bottom, it's going to slowly erase that image so that way it can be reused on another client. Okay, so having a look now over at my screen, this was an image taken, and as you can see, due to the scratching in the phosphor plate down here at the bottom, you can see that it is starting to impact the quality of the image, as well as up along the top here. Okay, so you can see that it is not a straight line, and that straight line is not there because that scratching and the peeling back within that phosphor plate. So if the dentist was taking a look and interpreting this radiograph, and maybe they needed to see the portion of the tooth here that's being covered, this would maybe potentially cause it not to be diagnostic. So in order to diagnose that tooth, the dentist may ask for a retake of that image. So now, although we utilize these phosphor plates to have less exposure time, as well as a lower KVP and MA, okay, so as compared to conventional film, we do require less exposure of radiation. So even though it did expose us less, we now potentially have the need for a retake in order to see and diagnose a certain area, and therefore the client is now being exposed to more radiation. So again, looking and thinking about that quality assurance and making sure that you make the sound decisions before exposing your client to check the integrity of your phosphor plates. So that is just one example of what may happen if you choose to utilize your phosphor plates. So you can imagine if there was a bend halfway in the middle from a client biting or a clinician bending it, how that could potentially damage the integrity of your image right across the middle.